Good afternoon, everybody. And this topic is slightly different from our routine topics, whether we need to consider endometriosis as a cardiovascular risk factor. How endometriosis is linked with cardiovascular disease? There is definitely some common relationship between the two diseases. One is depression and anxiety, which is seen in both cases. That is reduced quality of life, immune dysfunction, microvesicle formation, endocrine signaling, angiogenesis, oxidative stress, genetic susceptibility, and systemic inflammation. Systemic inflammation is going to be the most important cause. Endometriosis is the presence of normal endometrial tissue that is abnormally implanted in the locations other than the uterine cavity. The implants, they grow and invade the tissue in their vicinity, causing inflammatory reaction. So the prevalence is quite high. In younger age of onset predicts the more severe disease. It is more commonly seen in almost 25 to 40% of the infertile women, 75% of the women with chronic pelvic pain, 40 to 60% of the women with dysmenorrhea. Recent estimate has stated that around 196 million women in the world suffer from endometriosis, and in India alone we have more than 50 million women. And there is often a diagnostic delay ranging between 6 to 7 years, and the patient would have seen many consulted before coming to a definitive diagnosis. So these are all some of the epidemiological factors and the molecular and the cellular alterations that happens in endometriosis patients, which has been described in detail in the previous topics. So this is again, there is hyperandrogenism, and all the pro-inflammatory factors are elevated like COX-2, PGE2, VEGF, MMP, interleukin 8, cytokines, Th1 cytokine, interferon, tumor necrosis alpha, interleukin 6, anti-apoptotic BCL2, aromatase activity are all pro-inflammatory, and they are increased in endometriosis. And the anti-inflammatory cytokines and p53 apoptosis induction and Th2 cytokines are decreased in endometriosis. The clinical symptoms we have described in detail in the previous lectures. It can be 7D leading to depression and fatigability, and there can be always a combination of symptoms in these patients. Now, what is the epidemiology and economic burden? Here, 10% of the women and we are reproductive age group and women with infertility, and the annual cost for the expense towards endometriosis management is going to be high. When you compare it with cardiovascular disease, it is in unstable angina, it is only 5,700 euros, and in acute MI, it is more than 10,000, and acute stroke, it is more than 10,000. So it is almost the annual cost of managing an endometriosis is similar to treating coronary vascular disorder. So how to evaluate the patient? Through history, examination, imaging, and biomarkers. There are a lot of challenges in diagnosis, that too, especially in the early stage. It should be viewed as a chronic inflammatory disease that requires lifelong management plan with the goal of maximizing the use of medical treatment and avoiding repeated surgeries according to ASRM. The treatment goals aims at elevating the pain and promoting fertility, reduce recurrence, and improve the quality of life.